Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy-Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation. Well, fantastic. Good morning, good evening, good afternoon, depending on where you are in the world. Gary, would you like to start by introducing yourself?
Yeah, hi. Yeah, good day. Lovely to be here. My name's Gary Jones. I'm based in Cairns, Queensland, Australia. And I came here in May, recently retiring from the UN, where I was based in Geneva, Switzerland. So I'm starting a new life, but it's all very exciting, carrying on with the same themes of social inclusion, participation, fairness. So just exploring those themes in different walks of life. Thank you.
Oh, amazing, amazing. I'm really pleased that you've added the Switzerland piece in there and other bits, because actually your background doesn't start with Australia. You've done loads of things. Did you want to tell us a little bit about your background generally?
Yeah, well, 40 odd plus years in the saddle. It's most of my life, although not all of it, has been spent in Africa, in different parts of Africa. I've been a teacher. I started off as a teacher. I worked for many, many years in the not-for-profit sector, where I was a project officer and a regional director for Norwegian People's Aid, country director, covering Kenya, Somalia, and Djibouti. So after that, I moved over to the UN, to UNICEF, where I helped start up the Global Fund HIV Programme in Somalia. From there, I went to Yemen, did the same for UNDP, got their HIV grant from the Global Fund back on track. And then after that, I joined UNAIDS going to South Africa. And then after a few years in South Africa, moved to Kenya. And then after Kenya, finally to the headquarters in Geneva. There's a sort of a long list, but that's interspersed with months as a consultant or in the business with business coalitions, being a resource person. But otherwise, that's pretty much the track record. And at the moment, I am employed part-time by James Cook University at the Cairns, Queensland campus. But otherwise, I'm involved in a startup company called North-South Field Studies Safaris, where we are working on student abroad studies agendas, where we're trying again to promote the idea of diversity and inclusion. Last but not least, I'm just about to start a consultancy with UNAIDS, where I'm going to try and help to write a global position paper on HIV and humanitarian emergencies. Voila.
Well, okay. And this is exactly why the team was chasing you down, Gary, because this is not something that I think happens overnight. It does take a number of years to be in all the places and be amongst all the things to really gain the insight to sort of perform as a consultant and sort of create that meaningful change. It comes from a place of experience, and this is why you're so very much sought after. So thank you so much for just adding a bit more detail around that for us. So what would you say, in amongst all of that fantastic background, is maybe the one problem that you're trying to solve at the moment?
Inclusivity, I would say. It's just making sure that everybody is who needs to be at the table is at the table. Everybody is informed. Everybody has the opportunity to participate. No one is left behind. I mean, sadly, we see around the world prejudice, bias against certain ethnic minorities, etc. I do a lot of work with LGBT groups, and I think that for me is the pressing issue of the day. As we turn to populist politics globally, very often that has a ripple effect. And when we try to start up programs with different social groups, maybe they're groups on the margins of society, we find that actually quite hard, because coming with populist politics, it's mainstream. So anything that doesn't speak to the mainstream agenda is often left behind. So if there is just one thing, it's actually making sure that we can actually be inclusive, we can actually be fair, we can allow everyone who wishes to participate in their own development and the development of their community. Thank you.
That's really brilliant, and that's exactly why I invited you to come on and sort of speak, particularly about that principal participation, because it is sort of the umbrella almost term of things such as inclusion, anti-exclusion, even a reach to diversity, even links to equity. So I would say my next question here would be, what sparks your interest in participation, and how are you working to address participation directly through your consultancy specifically?
Yeah, it's multifaceted, and you've got to attack it from various angles. There's no easy fit. I think the first thing is to make sure that everyone is aware of what is happening around them. It's a critical assumption that we often make, is that what I know, well, of course, everyone else knows. And so when I see an issue, well, of course, everyone else knows that's an issue. That's wrong, of course. So whatever the issue might be, and at the moment, it's sort of, I'm spending most of my time working either on health or education projects. It's actually to make sure, are people aware that there are actually insufficient places of tertiary education? Are we aware that actually it is an issue, that the local community clinic has stopped functioning, or the community pharmacy has run out of medication? A lot of times, I think that people are too busy going about their business, surviving. In many of the societies, sadly, sad to say, is that people don't have time to actually look and have a look around. And I think that's one of the roles that I can do, is help bring a sort of a broader perspective at the community level to different social groups, to let them know, hey, you too have a voice, and it's just as important as the presidents or the prime ministers, and probably a lot more effective as well in getting jobs done. So that would be the first one, is to try to make sure that we are all aware of the issues. And of course, you know, I'm a human being, so I have my own subjective bias, but trying to be, as a social scientist, if you will, as objective as possible. I also think, again, it's an assumption that we make, is that when we talk of communities, we see this as a homogeneous whole, when in fact nothing could be further from the truth. So again, just using a bit of experience and using networks and working with some fantastic people, I think we've got to disaggregate, and we've got to break down that concept of communities, and we've got to see who actually are the power brokers, who actually is making the decisions, who actually is doing what, where, and when. It's a 4 Ws, if you will. To do that, I'm working with what I like to simply call a decolonization approach. Of decolonization is a big thing, and it means all things to all people. But my own particular take is, it helps us to analyze structures of power. It helps us to see historically, as well as in the present, who actually is making the decision, who could have a say, potentially, if not realistically, who can actually say what's doing what. By taking that decolonization lens, we can then start to see, yeah, okay, maybe we need to have a separate conversation with young women, young pregnant women. Maybe we need to have a separate conversation with a gay network. Maybe we need to have a separate conversation with school leavers or out of school people. And we've actually got to hear their story and listen to their story. And I think that is one of the things that I'm trying to advance forward, is to make sure we can hear from those various angles, those different social groups, and how we can actually then start to bring that into some kind of meaningful whole, how we can move forward. Decolonization theory, yes, very, very useful. But I think at the end of the day, it's still up to those same peoples, those different parts of the puzzle that make up the community, to actually see which ways forward. I hope that makes some sort of sense.
It absolutely does, and there's a couple of things I don't want people to miss when they sort of hear this. Is that one of which is that the ability to give a global perspective, take a global perspective, and make a local application. That is exactly what you gain from sort of thinking globally or global health equity. It's not about just about neighborhood equity or just about city or regional city, sort of national equity. The issues that we're talking about are global issues. And I just wanted to point out the fact that you're saying that by taking a global look at things, we can be better at problem solving locally. That's one thing. The second thing is you talk about decolonization. That was I was unexpected, but I'm glad you brought it up in terms of people tend to resist decolonization sort of theory or conversations around decolonization because they think it's solely about race. And you've just clearly clarified it has a bit to do about race, yes, but more importantly, it's really about power, and that sort of spans loads of different areas in education, in commerce, in environment, everything else. So actually, by decolonizing, sort of our thinking and our actions and ways of doing things, we are actually tackling much more than just the issue that gets maybe the most attention at the moment. So probably the third thing there is thinking about the application of that, which you talk about. Theory is great, but then action is even better. So thank you so much for sort of emphasizing those three things, probably without even realizing it, but that's what you've done. So thank you so much. So I would like to take it a step further and sort of bring intersectionality into the conversation and think in the work that you or other people are doing within participation, inclusion, other areas, how can we ensure that the work we're doing is intersectional? And you've alluded to that a tiny bit, but I really want to be more specific in terms of intersectionality and the work around participation.
Yeah, no, thanks. Not an easy one to answer. But again, not wanting to hop on about decolonization approaches, but I think one of its strengths is that it prompts us to think and act holistically. That, it's not just, okay, who made the decision, in the boardroom today, who's going to make the decision at home, who's going to do what. I think gender studies, gender analysis is very, very useful in this regard, in prompting us to take sort of an overall view, a very broad view of actually what is happening, because as we know, we all wear various hats during the course of the day, and it's actually trying to understand how we function as individuals. And noting as well that I'm a qualitative researcher, so again, I'm always looking at that lived experience of actually, how does it really feel? What does it mean to you? What's your perception? So I think taking that holistic approach of what makes up your day, I like to ask the questions when I'm dealing with these. What makes you feel good? What actually brings dignity? And that's a really key word for me. Well, how do you dignify your life? How do you dignify feeling good? How do you dignify that feeling of wellness, of being connected? Often it's a very difficult question to ask, but again, working with individuals or with groups in various cultures, and that the moment that's ranging from African refugees in Cairns, Queensland, right the way through to students in Kilifi on the coast in Kenya, ranging from different groups. It's just actually asking people, it's okay, it's not indulgent. Tell me what is the factors that get you motivated. What actually is really at the bottom of what's making you upset, of what's driving you? What are the issues? And I think that once we start to pull that apart, we can see that it's everything from shelter to food, to water, to integration into the local community. It's that social networking. And then I think once we've done that, and we can carry out all sorts of various thematic analysis, we can see, where we're going with this, what are the commonalities, what are people really trying to say or to get to. Once we've got that as a premise, I think that then greatly strengthens our hand in seeing where we need to go. Now, that could be everything from sinking a borehole right the way through to looking for a scholarship for a slum-dwelling youth, be it what it may. But I think, again, making the participant center stage, but genuinely making them center stage, saying, look, I'm not going to say anything, you tell me. And if you want to do that as a focus group discussion, that's fine. That's your call. I get very wary when it's okay, let's have a big group, because invariably then the power brokers walk in and people kind of tend to then not be as honest as maybe they could be. I think we have to be sensitive because this is real time. This is people's lives. And, you know, that whole adage of do no harm, I think it's much safer if we can actually talk to people in a safe space, come out with that agenda, where they are and where they want to go. So in so doing, we get a very broad, a helicopter view, if you will, of that perspective of all the different things and how they are connected. As I say, for me, from dignifying, being able to dignify one's life.
These
Thank
words,
you.
I really wish that we could just capture each of those little phrases and bottle them, because they have their own sort of their own piece in there that I think it would be terrible for people to miss. You know, you talk about, where you allude to domiciliary intersectionality, which is where people are staying, sort of experiential, you know, how people approach situations and how they receive those, what it means to them. And you speak about geographical inequalities as well, in terms of geographical intersectionality and what that means for people in terms of where they've come from, where they are and where they're going. There's so much in there, and I hope that people can really grab those key points, because they're not ones to miss. I would say probably at this point, a call to action is probably on the cards. So if you had one call to action for people out there, you've been giving little calls to action across your responses, but if you had to give one core call to action, a takeaway, what would that thing be?
Basically to listen, not to think that you have all the answers, but listen to all the people that you're working with. Seek peer support, listen, find out, gain an understanding. Don't just simply march in there and act. I think that's the big thing that I would like to say, is not to assume that we, the caregivers or the providers of aid, have the answers, because we don't. I would simply say, by means of encouraging, facilitating a genuine participation, just start listening. If I could just jump back a little bit, when I mentioned about an organization that I'm helping to set up with others, it's bringing Australian students, undergrads, across to Kenya, to Kilifi, on the coast in Kenya. And it's actually, we're embarking on sort of an environmental science course, but how they're going to do that, and it will be certified at the end, is that only 20% is in the classroom and 80% is out in the field, where they're going to be working with Maasai, seeing the pastoralist, that interaction between humans and animals and land. They're going to be out in the marines, looking at the fisher folk with dwindling fish stocks, to see how they're actually going to be able to do that. And of course, in the greater context of climate change. But that, in terms of experiential learning, getting out there doing, and the only way they're going to succeed is by listening, is simply sitting down, getting under the acacia tree, by the water well, wherever it might be, in the cattle camp, and actually finding out, how do you do it? How do you dignify your life? Help me to do the same for mine.
Wow, to be a student on that course, I think would be life-changing. The jealousy is creeping in, but I'm going to try and contain that at the moment.
You're welcome.
You know, it sounds like listening is a very clear call to action there. And, you know, I would hate for us to miss that, because I think that's come up a couple of times across guests, is to listen. So there's got to be some importance in that call to action if multiple people who have never met are all saying the same thing. So I'm sure that after hearing your conversation with me today, people will definitely want to get in contact or learn more about you. How can people go about doing that? What is your what are the platforms that we can sort of investigate you on?
Yeah, no, fine. That's great. And for anyone out there, greetings, hello. You're very welcome to be in touch. I need to listen. I need to hear from you. Okay, you can put up my email. That's okay. I'll give you the North-South Field Studies Safaris, which is this organization. That email, you can reach me there. At James Cook University, I have obviously a researcher profile. So I'll be handing over all those details. And please, yeah, I mean, I'd love to hear from you. Please get in touch.
Amazing, amazing. Gary, Dr. Gary Jones, I should say. Thank you so much for your time today. I think I'll be watching this episode back, you know, a couple of times just to make sure I've not missed anything as well, because I can hear that the wealth of experience that you hold comes through in every word that you share. So, you know, we're in your footsteps. You know, we're following behind you as you lead the way as a pioneer in this field. So thank you so much for all the work you do, and thank you for your time today.
Thank you very much. Thank you for having me. It's been a pleasure.